Did you know access to transportation is directly related to a person's health? Hi, we're the Livewell Kershaw Coalition. We're a grassroots organization working to collaborate with both public and private sector organizations to increase community awareness of health issues. We're also part of the Community Medical Clinic of Kershaw County and funded by the Duke Endowment Healthy People, Healthy Carolinas initiative. Our goal is to improve the health of Kershaw County residents by encouraging our community to act together in reducing chronic disease and obesity. To fulfill this big mission, we co-created the CHIP, a Community Health Improvement Plan, back in March 2019. From that plan, 3 action teams were formed to keep Kershaw County moving forward on our path to good health. In this video, we're focusing on the Access to Care Action Team. This team's goal is to increase and improve ways to access affordable healthcare and transportation services among rural and underserved residents. Let's go back to transportation and its impact on a person's health. Transportation touches almost every aspect of a person's life. Having adequate and reliable transportation services are fundamental building blocks to healthy communities. Transportation issues can affect a person's access to healthcare services, and the lack of transportation, that can result in missed or delayed healthcare appointments, increased health costs, and overall poorer health outcomes. So what is the Access to Care team doing about this? Beginning in 2019, we began a conversation with the Santee Lynch's Council of Governments, who was already working on a transit need assessment, identifying areas of high need for transportation in our community with recommendations for proposed bus stops. This assessment included several new bus routes and stops in our community, with a full breakdown of a cost analysis and investment from the community needed to make it happen. We rolled up our sleeves and got to work on how we can make this plan a reality. Then, 1 year after forming our team, COVID-19 swept through our community. We quickly pivoted our attention to include those impacted by the virus. Thankfully, the CARES Act provided emergency funding to establish a temporary 2-year route in Kershaw County. The purpose of this route is to connect people to medical resources and social services during this pandemic. The route will run from East Camden to Elgin with 29 recommended stops along the way. It will also provide transportation to Sandhills upon request. As of right now, we have a temporary solution to getting folks access to transportation they desperately need. But funds for this route are only in place for 2 years after implementation. We are actively looking for community partners to join our Access to Care team and be community champions for making Kershaw County more accessible to us all. If you'd like to get involved, please contact Catherine Johnson at kjohnson@cmcofkc.org. We can't wait to get rolling with you.